This nerve provides motor innervation to which muscles? Gabby here from bootcamp.com, and here we're looking at a dissection along the anterior and medial aspects of the thigh. So just to orient ourselves a little bit here first, we can see more inferiorly is going to be the patella or the kneecap. So everything above here is going to be most of the thigh. So we have the anterior thigh here, and we have the muscles of the medial thigh that are found here. Now, within the anterior compartment of the thigh, we have a variety of muscles that function to either flex the hip or to extend the knee. A few muscles that are responsible for extending the knee include our quadriceps femoris muscle, which is made up of 4 muscles, such as the rectus femoris, which we can see right here has actually been cut and reflected away. We'll be able to see the vastus medialis. On the lateral side, we can see part of the muscle there. This over here is going to be the vastus lateralis. And then deep to the rectus femoris and in between our vastus lateralis and vastus medialis, we're going to have the vastus intermedius. So those 4 muscles all make up the quadriceps femoris, and they will go ahead to extend the knee. We could also see some muscles that help to flex the hip, including the sartorius. So the sartorius has also been reflected. We see its more proximal end here and its more distal end here, but the sartorius is going to start all the way at the hip and will eventually travel down the anterior thigh and travel medially, where it will go insert along the pes anserinus or along the areas of the medial side of the tibia. We also have another muscle that is found somewhat in the anterior compartment, but is technically found more laterally. This guy right over here is going to be the tensor fascia lata. So it sits right on the side, so on the lateral side of the anterior thigh, and then eventually goes to insert along the IT band, which we can see right here, that will continue to go along and attach onto the knee to help stabilize that knee. Another couple of muscles, I'm just going to go ahead and zoom in here, but another muscle that is also going to help flex the hip along with our sartorius is going to be the iliopsoas muscle, or the muscle that is made up of the iliacus muscle and the psoas major. So we can see that muscle right over here. It's going to travel downwards and will eventually help when contracts, it will help flex the hip. And the last muscle that is found within the anterior thigh, it is found more medially, basically in between the anterior and medial thigh, but it's very small. We could see it right here underneath the vessels. This is going to be the pectineus muscle. So as far as our muscles of the anterior compartment, we have the psoas major and the iliacus forming the iliopsoas. We have the pectineus. We have the tensor fascia lata. We have the sartorius, which we can see right here. And we also mentioned our 4 quadricep muscles. So all of these muscles, in order to perform their function, they need motor innervation from a specific nerve. And the main nerve that provides motor innervation to the muscles of the anterior thigh is the femoral nerve. And the femoral nerve is tagged right here. And we can see that the femoral nerve sits within the anterior compartment of the thigh, and it sits adjacent to the femoral artery and the femoral vein. So this neurovasculature, the femoral neurovasculature, is actually going to be sitting in what we call the femoral triangle. And the femoral triangle is found along this region. It's bordered superiorly by the inguinal ligament. It's bordered medially by the adductor longus muscle. And then it's bordered laterally by that sartorius. So going from medial to lateral, we're able to identify the femoral neurovasculature. So we have the femoral vein, the femoral artery, and then the femoral nerve. So most of the muscles that are found in the anterior compartment do receive some innervation from that femoral nerve. However, there are a couple of exceptions that I do want to note here. So the tensor fascia lata, instead of receiving innervation from the femoral nerve, it's going to receive innervation from the superior gluteal nerve instead. The TFL, the tensor fascia lata, is one of those exceptions, and another one of those exceptions is going to be the psoas major and the iliacus, so the iliopsoas. Although there may be some branches of the femoral nerve that are innervating and piercing this muscle is generally innervated by the anterior rami of specific lumbar spinal nerves. So based on what I just told you, the femoral nerve provides motor innervation to which muscles? So those muscles are going to be the quadriceps, the sartorius, and the pectineus.